Good day all. My name is Olademeji Joseph, a community health officer, the supervisor in charge of tuberculosis, leprosy, and borreliosis in Ikeja local government. That is under Health District 6, Lagos State. We are trying to discuss many salient points that people need to know about tuberculosis as far as Lagos State is concerned, as far as tuberculosis control is concerned. When we are talking of TB, we are talking of tuberculosis. And when we are talking of tuberculosis, tuberculosis is one of the tropical diseases that is rampaging globally, not only in Nigeria. But Nigeria happens to be one of those countries that is with the high burden of tuberculosis globally. And in Africa, we ranked number 1. And in Nigeria, Lagos ranked number 1 or 2. So that is to tell us that we really have a long way to go. So how do we contact tuberculosis? Well, somebody that has tuberculosis coughs, sneezes, or even when they are talking like I'm talking now, there are some particles that get out of our mouth, there are some particles that get out of our nose. And these particles, when they get out, some could be in the air, suspended for quite some time. Even the one that drops on the floor, any opportunity they have when you are sweeping or when you are mopping, once it's not a wet mop, they can spring up, and a susceptible individual within the environment will inhale it. And when we inhale it, it becomes a problem over a long time. Tuberculosis bacilli actually has affinity to a very cold place. Possibly that was one of the reasons why the lungs happens to be its base, because it's primarily a disease of the pulmonary, which is the lungs. Let me call our attention to the fact that the bacilli that causes tuberculosis is called mycobacterial tuberculosis. It is the same compound that the one that causes borreliosis is being called mycobacterial lazarei, and the one that causes leprosy is called mycobacterial leprae. So the three of them, that is why when you are talking of tuberculosis, they were merged with leprosy as well as borreliosis in terms of control. Having said that, what are the things that can serve as signal that this is likely to be tuberculosis? Once you see somebody that is coughing up to 2 weeks or more, suspect tuberculosis. When you see somebody who is having a low-grade fever over time, especially children, up to 3 months, 5 months, 6 months, sometimes they are in and out of hospital. They treat malaria today, they treat typhoid tomorrow. If such a child is tested for tuberculosis, it's likely to be positive. What of somebody who is losing weight unexplainably? Sometimes they might think it's an HIV patient. It may not be HIV, it might be tuberculosis. And the last of the major cardinal signs is night sweat. Drenching night sweat. Somebody just sweating profusely at night. Even when others are feeling cold, it might be a case of TB. But in addition to that, if somebody is having chest pain because it's a pulmonary TB and the lungs will be affected, or you see somebody coughing out blood, definitely the blood is coughing out is from the lungs. So you might equally suspect that those symptoms might be that of TB. Then, how exactly do we now arrive at diagnosis if you are suspected somebody is having TB? The first thing we do is to collect the sputum sample. When you collect the sputum sample, it is taken to laboratory where gene expert is going to be run. When you run a gene expert, it will come up MTB detected. But even if it is MTB not detected, that is not to say that person is not having tuberculosis, because the quality and the quantity of sample produced goes a very long way in determining that. But in addition to this collection of sputum, which could be used for gene expert or for culture, then we do run chest X-ray. Chest X-ray most of the time will come suggestive because it is an imaging testing mechanism. It's not going to be precise. So, but when it says TB is suspected or suggestive, then that gives us a clue that we should go ahead and conduct more examination. But for children who might not be able to produce sputum sample, stool is being collected. You collect their stool, and you take it to the laboratory so that you can run gene expert. Also, they do gastric lavage so that it's essentially where they probe their throat to bring out those things there, and often it is as good as if an adult had produced sputum. Then, for those who are diagnosed to have had tuberculosis, all hope is not lost yet. The best thing we do is to place them on treatment as early as they are diagnosed. The drugs are available at all times in all our primary healthcare centers and some private facilities. But the drug duration is not less than 6 months. No matter the type of TB that an individual is having, it's not less than 6 months. So that duration itself is a challenge. And for us, even taking antibiotics or antimalarial for 3 days, many of us default. How much more somebody taking medication for a good 6 months? So they really needed encouragement from members of the society. Then let me call your attention to the fact that TB do not affect only the lungs. There is what we call extrapulmonary tuberculosis. When you call it extrapulmonary, which means it's outside the lung. We have seen the one that affected the breast, the testes, the kidney, the liver, and all sorts of organs in the body. There seems not to be a particular organ in the body that is not being affected by TB. That of the brain, that of the bone is more common. So once it's outside the lungs, it's been addressed extrapulmonary, but once it's within the lungs, it is addressed pulmonary. But there is a particular one I need to call your attention to. We call them drug-resistant tuberculosis. For people that were placed on drugs, who are not being religious in taking their drugs, possibly instead of taking 4 tablets, they are taking 2 in the morning, taking 2 in the night, or when you say they should take their drugs empty stomach, they are taking it with food or with minerals, then the efficacy of that drugs will be minimized. And once it has been compromised, then it's not going to work well. So some of them ended up coming with drug-resistant tuberculosis. Or some individuals have been coughing. You see some of them for a whole year, for 2 years, they have been using various antibiotics, and which will make them to develop resistance even to the anti-tuberculosis drugs. So for this kind of patient, there are specialized treatment, which were called individualized treatment, which they were given, which is quite different from the conventional treatment that we are giving other people. Then, how do we prevent tuberculosis? The major means of prevention of any disease is to ensure that the chain of communication is broken. How do you break the chain of communication? Ensure that you imbibe what we call cough culture. Cough culture means when you want to cough, ensure your mouth and nose are covered. Once it is covered and the germs within you are not getting out to another person, you have contained the movement of that disease. So, imbibe cough culture. If, for example, you are not holding any tissue paper or handkerchief with which you can cover your mouth and nose, you can use your left elbow, just the way I'm done. You cover your mouth and nose. By doing so, you will have prevented your loved one, your friend, from contacting the disease. But beyond that, once we have diagnosed somebody who has gotten bacilli enough in the body to the extent that it was discovered in either the sputum or the stool, then we give them what we call TPT, which is tuberculosis preventive therapy. There are some drugs. There is one we take for 1 month, the one of 3 months, the one of 6 months, which will be given to individuals so that their immunity could be boosted, so that even if they were exposed, then they will not contact the disease. And if they contact the disease, it will not be able to be established in them because they have already gotten a very strong immunity. Let me add that community has a role to play in controlling tuberculosis infection. And what are their major roles? Number one, when you have a patient around you, somebody has been diagnosed tuberculosis, then you become a counselor. Ensure you counsel that person and you guide that person. Encourage him on how to take his drug. If financial constraint is his or her major challenge, do whatever you can do to help. Because anyone that will have the power to assist is that person is your partner. You have seen a few of them that will come to the facility, they don't have food to take, and in the actual sense, because of the disease, they can't do any other work. And when you get to that level, they have to depend on you. Do not let them down. Number two, a friend that we had together in the morning, in the afternoon, he was diagnosed of TB. In the evening, many of us will run away from them. Just because they say it's a TB patient. If he wants to infect you, he will have infected you right before he was diagnosed. So it's not a time to run for them. It is a time to actually embrace them. You show them love and see how you can assist them. But let me now add that management of TB, testing for TB, the drugs, and everything that has to do with tuberculosis here in Lagos State and even in Nigeria, it is free of charge. Nobody charges anything for tests. Nobody charges you anything for treatment. That is for the medication. However, the fact that it's free doesn't mean that the drugs is coming from heaven. Somebody had paid for it. Therefore, you need to be religious in the taking. You don't undermine the drugs, and you don't compromise taking the drugs. By the time you have done this, definitely you will have tuberculosis. Tuberculosis is curable. However, for those who decided not to adhere to medication, for those who decided not to even come to testing because of the fear that they might have tuberculosis, those are the people that lose their lives to tuberculosis. Ordinarily, TB doesn't kill. However, be warned, TB anywhere is TB everywhere. I repeat, TB anywhere is TB everywhere. I can cough where I am. It can be suspended in the air, can travel a kilometer, and anybody over there will inhale it. So it doesn't matter wherever you are, as long as you are breathing, you are susceptible to tuberculosis. You don't need to go to hospital before you contact it. You don't need to stay with somebody who has TB before you contact it. Anywhere you find yourself, and this is why sometimes the use of PPE, that is nose cover or nose mask, as the case may be, is very useful in preventing ourselves from contacting TB. And for TB patients too, we encourage them to use it so that instead of releasing the germs outside, that is the bacteria, is better they keep it within. So far they are already taking treatment. We all pray that every one of them that are diagnosed of TB will be free of TB, they will be healed completely, and it will never descend back to them or even a member of their family. So with this, I want to conclude my message to you. Please, when you have an opportunity, do not hesitate to surrender yourself for TB testing. There are ex-travel that are moving from community to community today. If you go to any of the health center in Mushin local government, in Odiolowo you want to mention, in also the Solo local government, or to talk to Tuberculosis LGA, or Ikeja local government, talk to Onibungu, you want to talk of Tuberculosis LGA, all our PSCs, they are treatment center. Once you walk in there and say you want to undergo test for TB, they will give you necessary assistance and you will undergo your test. And who tells you that may be a saving grace that you will have. I implore you, please do not hesitate to continue to manage yourself well by preventing yourself. Prevention is said to be better than cure. Not only that it's better, it is equally cheaper than cure. May God bless you all. Thank you.